This podcast is intended for healthcare professionals, including dentists, for educational purposes only. It should not be considered medical advice, a product endorsement, or promotional material. Welcome to Decoding Dentine Discussions, the podcast where we dive deep into the latest developments and best practices in the world of dentine hypersensitivity. I'm your host, Dr. Shaista Siddiqui, and today we have an enlightening episode ahead, Dentine Hypersensitivity Demystified. We're incredibly lucky today we have joining Dr. Manal Awad, a distinguished professor from Sharjah University, United Arab Emirates, and an expert in the field. She is also a chief investigator of dentine hypersensitivity epidemiological study in the Arab population. Today, we will be breaking down the complexities of etiology, mechanisms, and epidemiology of dentine hypersensitivity and the effect that this can have on quality of life. Before we go to this in depth, I'm just going to get Dr. Manal to tell us a bit more about herself.
Thank you, Dr. Shaista. My name is Manal Awad. I'm a professor of public health and the chair of the Department of Orthodontics, Pediatric and Community Dentistry at University of Sharjah. I have obtained my PhD from McGill University and started actually my career at University of Sharjah until today.
Amazing. So it seems like you've had a lot of experience working in different countries, Canada, Egypt, the United Arab Emirates. So there's a lot to draw on from here today.
Yes.
This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne is committed to providing all-round dental care for your dentine hypersensitivity patients. So before I start asking you questions, I just want to give a bit of a preamble. In June 2024, Halion and CAP hosted an international advisory board focused on the diagnosis and management of dentine hypersensitivity across the Middle East and Africa. In this series, we're exploring the key outcomes and clinical insights from that event, offering practical advice and evidence-based approaches to improve patient care. Today's focus is going to be very much on what is dentine hypersensitivity, pain associated with it, the management, the etiology. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website. So one of my first questions that I'm going to ask you is, how can dentine hypersensitivity pain be described?
Well, dentine hypersensitivity is characterized as sharp temporary pain or discomfort in one or more teeth when exposed to certain stimulus. That could be hot, cold, sometimes with sweets or acids from foods and drinks. It can also sometimes occur due to brushing and flossing.
How is dentine hypersensitivity pain different in pain or location to other types of dental pain?
Well, dentine hypersensitivity pain arises from exposure of the dentine, typically in the response to any chemical, thermal, or osmotic stimulus. It can be, it has to be separated from pain that occur from any other pathology that occurs. So the diagnosis of dentine hypersensitivity is very important and the clinician should exclude any other factors, a fracture or fault in the restoration, a cracked tooth, or any other condition that also can mimic the same pain that occurs due to dentine hypersensitivity.
Okay, great, thank you. So you were a part of the AD board in June, and one of the definitions that was given for dentine hypersensitivity was a short, sharp pain arising from exposed dentine in response to stimuli, typically thermal, evaporative, tactile, osmotic or chemical, and which cannot be ascribed to any other form of dental defect or pathology. One of the outcomes of the ad board was that we felt that this was not a complete definition, and an element that was added on was the quality of life aspect. So why do you think there was a need to add on the quality of life aspect to the definition?
Well, it's important because the pain that occurs as a result of dentine hypersensitivity means that for some patients, they may avoid certain foods that may enjoy. They somehow try to adapt to the condition, which will inevitably, for some patients, will affect their quality of life by there could be enjoyable foods or drinks, affect their social life in that aspect. And therefore, it is important from that point of view.
Amazing. So now we're going to sort of come on to understanding the etiology of dentine hypersensitivity. Why is this so important to understand?
It's important to understand it because that's important for the diagnosis of the condition to be able to manage it properly. So there are several clinical conditions that could play a role in the development of the of dentine hypersensitivity. There is, for example, the enamel attrition, which is the gradual wearing down of the tooth as a result of chewing and grinding of the teeth. There is the enamel erosion, which is caused by the acidic foods or drinks, some of the soft drinks, acidic juices, acid reflux, a condition that some patients may suffer from. There is also the enamel abrasion, which occurs due to the mechanical friction. For example, rough brushing of teeth usually biting nails, they all usually can lead to enamel abrasion. And the last one, that enamel abfraction, which is tooth wear from the forces that due to the occlusion of the teeth. With time, it can lead to a depression, and therefore it can lead to the condition.
So I'm curious, having worked in the UAE and Egypt, you've mentioned you've worked, can you pinpoint any one? Have you seen more? Can you pinpoint which one of these actually has happened more in, say, the UAE, which has caused dentine hypersensitivity more?
The erosion.
The erosion
is really the number one cause in the UAE and in most Arab countries that we conducted the research.
The erosion down to diet rather
is
than
related
health
mostly
related.
to diet, especially among the younger people because of drinking a lot of acidic drinks, soft drinks. That really is the number one cause of the problem in Arab countries.
Okay. And could you also explain to us the mechanism of dentine hypersensitivity? So at the moment, the most widely accepted theory is the hydrodynamic theory. Could you tell us a bit more about this?
Yes, there have been several theories. However, the hydrodynamic theory is the proposed theory since 1966, where what they suggest is that the dentine hypersensitivity, due to the abrupt movement of the fluids within the dentinal tubules, and in response to a stimulus such as cold or heat, and that stimulus will lead to the movement of the fluids, the mechanical movement, which result in activation of the sensory nerves, and therefore the patient would feel actually the pain.
Okay, perfect. So I remember from my undergraduate days that there were some other theories as well. And what was actually eye-opening for me is that when we did the ad board, I learnt that the other two theories were not quite so acceptable. So if you could tell us a bit more about that.
Well, the first theory was called the direct innervation theory. And the idea was the nerve endings that would enter into the dentine through the pulp, and therefore they would cause the mechanical stimulus directly transmitting the pain. However, there are no enough evidence to show that there can be nerves in the superficial part of the dentine that would lead to that sensitivity. So that theory was not really supported by science. The other theory was the odontoplast receptor theory. This theory assumed that the odontoplast act as receptors of pain and transmit signals to the pulp nerve. But this theory has also been rejected since the cellular matrix of the odontoplast was found that it is not capable to produce neural impulses. So therefore, both theories were dismissed as the possible reason for the pain the patient would complain of.
Thank you. So I think we're really going to draw in on your expertise now, especially being in dental public health and having done epidemiological studies. So if you can talk a bit about prevalence and why there's a variation in data with regards to prevalence.
Well, prevalence varies for two reasons. The first reason is because the way diagnosis of hypersensitivity depends on the studies and how the diagnosis. It's based on the patient's perception of the pain. And also it actually varies between 4% and up to maybe 75% of the patients would in different it's big. And also because different countries, different culture, different lifestyles, the food people are used to drinking makes that variations. That's why it's important to look at each country separately and assess the prevalence of the condition.
Okay, thank you. Can you, is there I mean, you mentioned the numbers 4% to 78%. Can you talk about, is there a significance in prevalence related to geography?
Yes, absolutely. I'll give an example in the Arab countries and the studies we conducted. We found, for example, that it was on younger people between the age of 18 to 35. And in the Gulf region, in GCC countries, the prevalence was extremely higher compared to other Arab countries like Jordan and Egypt.
Okay.
And one of the reasons is the consumption of the soft drinks.
Wow.
That makes a big difference. We correlated that what the patients said, how much the frequency of drinking acidic foods and drinks, and it's obviously that was the major risk factor.
To know. Thank you for explaining about the theories and why the last two have been rejected. So I'm going to now draw on your experience having been in dental public health and doing epidemiological studies. We're going to talk about prevalence. Can you explain what the prevalence is like in the Middle East and Africa area and why there's a variation in data with regards to prevalence?
Well, definitely there are quite large variations between studies. It goes 4% in some countries, up to 78% in others. Certainly the study we did in Arab countries, the GCC countries had the highest level of dentine hypersensitivity compared to other Arab countries. And we concluded that's probably due to the acidic drinks that younger people tend to consume in high frequency. There are also the sample of participants. Some studies would include younger people, some other studies include older people. Okay. These are all factors that contribute in addition to how dentine hypersensitivity is being assessed. It also may play a role.
So, sorry, you...
In the end, it's a patient perception, and therefore we rely on the patient and if they are in pain or not, and therefore that's why you see some changes as well between countries in terms of the prevalence.
Okay, that's quite interesting to know. The geography you mentioned that certain countries there seems to be more access to acidic diet, other countries not so much. You've probably got the experience of how these things are addressed. Was there a way that this was addressed in these different countries?
Yes, when we asked participants who had the condition, who suffered from the pain, they would report a very high frequency, for example, of consumption of acidic drinks, soft drinks specifically, were quite high, especially in younger people in GCC countries, as compared to other countries. In Europe as well, there are high prevalence of this condition as well. And the number one cause was the consumption also of acidic drinks.
Okay. Can you explain to us why is there a variation between male and female prevalence?
Yeah, most studies would show that females tend to report more pain related to dentine hypersensitivity. That because, first of all, women have, or a lot of the studies show women have less tolerance for pain.
See, I was really surprised by that. I generally thought women have much better tolerance for pain. And
well, no, actually, the lab studies show that women they might endure it, but it's still.
So that's the key difference. We endure it.
Yeah, endure it, but they have less tolerance. Also, men, for culture reason, they wouldn't want to complain of the pain, even if they have the pain.
Okay.
So that's another factor that has been. But most studies would show that women tends to report it more, the pain from dentine hypersensitivity than men.
Okay, that's quite interesting for me. I did not believe that initially. Okay, can you explain to us how does dentine hypersensitivity impact quality of life, and what data do we have to support this?
Yeah, there are studies that shows that patients, when they suffer from the condition of dentine hypersensitivity, they will not be able to enjoy some of the foods and drinks that they like. In addition, that may have an impact on their social life, and therefore that discomfort will affect quality of life. There are also studies that show when the condition is managed and the pain is less, they would report that this had a positive impact on their quality of life. Certainly, there are several studies that would show that.
Are you able to recall in these studies how the dentine hypersensitivity was managed? If you can briefly explain that.
Well, there are studies that, for example, would show that usually desensitizing agents, toothpastes such as Sensodyne, would actually help with reducing the pain that results from this condition. And therefore, when patients are asked if there are any limitations in consumption of certain foods or drinks, they would report that it improved. Okay. It has also psychological discomfort that comes with it that also have been shown to reduce as a result of the management of the condition.
Amazing. So one of the things that also was highlighted in the ad board was about diagnosis. There's the statistic is that nearly 1 in every 2 people suffers from it, but they're not diagnosed. People don't complain about it. So can you explain to us why it is so hugely underdiagnosed?
Well, the reason for the underdiagnosis is related to the patients and to the clinicians.
Okay.
If we look at the patients, sometimes patients were found when they were asked, they would say, well, it's part of aging or it's normal that I would feel some pain when I drink a cold drink or a hot drink. So they don't necessarily seek treatment or consultation of a dentist because of this problem. On the other hand, from the dentist point of view, clinicians avoid asking patients about dentine hypersensitivity because they perceive it as it's not well defined or difficult to treat. Time management of the clinical time with the patient. We have to remember that patients come for another reason to the dentist, where the dentist would actually focus on the main complaint or the chief complaint of the patient. So this is why it turns out to be underdiagnosed.
So, as I said, this was something that was highlighted in the ad board. Having been part of that ad board and understanding the patient side and the dentist side of why there's underdiagnosis, rather, has anything changed in how you practice or how you get your students to diagnose? Have you implemented anything after the ad board?
Well, we talked a lot. Part of it is the education and whether there should be continuing education, seminars, workshops to help the dentists. We also have an obligation, considering the high prevalence of the condition, to teach dental students while they're still in their undergraduate years about the importance of it's part of history taking from the patient, that actually you would ask them about this condition, including the medical information we gather. And we do that actually for our undergraduate students. That's very important to come up with this being added to curriculum, undergraduate students.
Perfect. So explain to me, what are the sequelae of dentine hypersensitivity, and has this been quantified, like the economic impact of dentine hypersensitivity on patients, dentists, government, and so on? So can you explain this to us?
Yeah, there is certainly an economic consequence. And I'll give an example from the UK, where they conducted a study to look at the average treatment time. It can range between 8 months to 44 months of treatment. And the number of clinical visits are also very high. It could go up to, we're talking 3 to 4 years of treatment. The cost is also can go up to £4,800 because it depends on this the seriousness of the condition and the number of teeth that are affected. So clearly there is an economic consequence. That means if we treat it earlier or manage it earlier, we wouldn't need
wouldn't be such a financial burden.
A burden on the patients or health insurance.
On the health insurance, so what are the sequelae of dentine hypersensitivity? What can it result in?
You mean in terms of the treatments and...
in terms of, worst case tooth loss or, the pain getting worse, becoming pulpitic, that kind of thing.
That's why the cost of the treatment go up, because if it's managed early on, then it's less invasive. The problem is when we start to put crowns on the teeth, have to do a root canal treatment and then put a crown. All this would be costly, and this is why we see the cost to be very high. And of course, depending on the number of teeth that are affected significantly.
So what would you say is the simplest preventative technique or management for dentine hypersensitivity?
Well, the first treatment should be the least invasive, and using toothpaste that contain filler substances, as I mentioned, Sensodyne, for example. It will to help with the dentinal tubules so that the patients don't feel the pain. It's easy to use, inexpensive, and the patients can use it themselves. So that's certainly the first line of management.
Do you think patients are aware of the consequences of dentine hypersensitivity
Absolutely not. I don't think that is the problem, that they, unless the dentist explain and early on diagnose the condition and that it is, the pain is due to dentine hypersensitivity. By the time the pain becomes intolerable, that's when more invasive treatment would be needed. That obviously costs a lot of more money. So clearly patients need to be educated about this condition as well.
And then, I mean, I'm curious, you mentioned this study in the UK, and what I'm thinking about, the UK has the national healthcare system. And then if I compare it to, say, the UAE, where it's all insurance-based, do you think that is a barrier to patients, that where something is... where a problem is a burden on the government, people are more willing to go, but where a problem is a burden on your pocket, they're not so willing to go? What do you think?
Yes, absolutely. I agree with that. Certainly the health insurance system in different countries would have an impact. But in the end, I think early intervention is better. Someone is paying for the treatment, whether it's the patient or the insurance. Even for the patient's time. I mean, if we talk about someone having to go to a dentist for 2 to 3 years to actually treat the teeth, if it was managed earlier and diagnosed earlier, they would have avoided that. That would be certainly something that we need to work on.
Absolutely. So one last question for you. The ad board, what was your key take home from that?
Well, first of all, it was a great idea to have an advisory board to discuss the dentine hypersensitivity condition, given the high prevalence and the fact that most of the dentists in our part of the world, they actually don't. I don't want to say take it seriously, but they don't ask the patient as part of their routine checkup. And we want to highlight this,
it needs to be
importance.
A more holistic approach, not a single tooth
exactly.
problem.
So we have to encourage dentists. We also have a role to help the dentists understand how to diagnose it, understand the treatments that are available, the time it takes, because I think that's another barrier for the dentists when studies have been done in the UK where they found and say, well, I don't know how much time that would take, considering that was not the chief complaint of the patient or why they came to visit the dentist.
Thank you very much, Dr. Manal, for your insights and for giving us your expertise in this topic. So thank you again for making time for us. So I'm just going to just go over, this has been really amazing. We've talked about the definition of dentine hypersensitivity. We've talked about the kind of pain it is and how important it is to understand the uniqueness of dentine hypersensitivity pain as compared to other kinds of dental pains, just so that our diagnosis is correct, so that our treatment modalities are correct. What's been also interesting is the causes and mechanisms, especially the theories, the debunked theories. I think it's important that we understand the whys of that. Prevalence, it's interesting how it varies. Again, it highlights, the different ways in we're diagnosing and different methods that we might be using. And again, women, I think, suffer in silence as well. Right? I still believe in that. But, it's important that we come together and have a unified approach in diagnosing this so that we can have a more positive impact for these people and their quality of life. So thank you very much, Dr. Manal. I hope everybody's enjoyed this episode, that we've shed some light on the complexity of dentine hypersensitivity, and we hope that this has created some awareness amongst colleagues about, we really do need to be thinking about having a more holistic approach. I hope you all will join us for the next episode, where we're going to go in a little bit more deeply about diagnosing dentine hypersensitivity and not confusing it with the other dental diagnoses. Thank you. See you for the next episode. This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne is committed to providing all-round dental care for your dentine hypersensitivity patients. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website.